Today we're going to talk about what what are the major ways that we're going to monitor the impact of well-being is natural with the Catalytic Health Partners Health Program. One of our biggest goals is to help the members start to increase their sense of functioning physically and mentally in their lives. And one of the ways that has been proven to be a very effective monitoring mechanism are health service and health functioning surveys. So the SF36 means short form 36, was developed in the 1970s, and it was evaluated with looking at about 149 different questions that have been reduced down to 36. There's actually a shorter form that has 9 questions. In my opinion, this form, the 36 question form, is more superior and gives us better range of understanding the impact that health promotion or health enhancement has on people's functioning, as well as what we're looking at is, can we reduce the burden that people's injuries or diseases or lifestyles have on their overall functioning, their functioning physically and mentally. So the SF36 was really put together to try to compare different health benefits from people being involved in treatments of medical interventions, as well as screening individuals as far as are they appropriate for what type of care. We're going to look at it from the standpoint of getting a baseline of the individuals that are going through, the members that are going through the program, and we're going to use that baseline to then compare it mid-range after they're about halfway through the program and then at the end of the program, and potentially afterwards as we look at them longitudinally. We want to see the main parameters of this program are addressing the issues that this particular scale helps us monitor. So if you look on the sheet that's in front of you on your screen, you see that there's 8 basic functions that it's monitoring: physical functioning, role physical, bodily pain, general health, vitality, social functioning, role emotional, and mental health. Now, these domains are broken into so many questions, and some of these questions are assessed as far as whether they have been able to accomplish this in the last 7 days. And some of these questions are based more immediately on how are you feeling right now. So as you look at physical functioning, we're looking at vigorous activities, moderate activities, lifting and carrying. These are daily functioning activities that most of us go through every day. And what we're assessing is how well they're able to carry out these daily functions and what degree they have as far as any limitations. Then you start to look at not only the physical functioning, but also the impact that it has on their role. Does it cut down time? Have they accomplished less? Or are they limited? Have they had difficulty? So it gets you at not only just the physical functioning acts and activities, but also looks at their role within them. And then it looks at their bodily pain, the magnitude of pain, and pain, how much pain is interfering with their lives. In general health, it's looking at that they may have excellent health. That's what the EVGFP is standing for. Is the E is standing for excellent, the VG is very good, the F is fair, and the P is for poor. So they're giving you a general rating of their health right now. And we want to know whether they feel like they're also their perception of their health. Do they get sick easier? Are they as healthy as they used to be? Has their health gotten worse? Or is their health excellent? And it's a 5-scale rating with most of the questions, and some of the questions it's yes or no. You're looking at vitality and how much energy they have, how much pep, how much they feel worn out or tired. You're also looking at social function, social extent, and social time. To what degree are they social, is the social extent, and how much time do they spend in social functioning? The next area is looking at role emotional. Have they had to cut down on time that they're involved with others? Have they accomplished less? Are they not as careful? Or their mental health functioning is looking at, are they nervous? Are they down most of the time? Do they have some sense of peace? Are they sad? Are they happy? Again, this isn't a complete diagnostic category, these questions. These are giving us global indicators of which have been proven over time in 40 different countries that these scales still hold up across cultures as well as across age groups and across physical functioning groups. Now we're going to look at another area, and that area is to what degree are they really looking at in this SF36, what does this really mean? And so as we start to see that the Wellbeing is Natural program is also trying to have an impact on most of all of these areas directly. So the physical functioning, that they're able to perform all types of physical activities, including most vigorous without limitations or due to health problems. And we've started to see the reliability of these collection of questions is very high. And we're trying to also influence people in the program, in the Wellbeing is Natural program, to start to take some measures every day, whether it's doing their their yoga stretching, or whether they're doing some mild exercise, or whether they're using their meditation. All of these are starting to have an impact on that physical functioning. Their eating plans, the amount of water they're drinking. But we're also finding that not only that just those specific exercises might have an impact on these areas, but we also are finding that as a person starts to have a little more social interaction, say with their buddy, that it gives them more of a feeling like they want to get involved socially, which then increases or has an impact on their physical functioning. So these are not necessarily linear categories going with linear components of the Well-Being is Natural program, but they are interactive. And they give us a measure of looking at, as people start to monitor on a daily basis and start to show us, are they doing these exercises? Are they keeping their goals? Are they following through with the just doing it list? Are they following through with their buddies? And we start to see that it's also increasing their sense of energy, their sense of social belongingness, and it's helping them have a greater feeling of control over their pain. And they have a greater sense of vitality, and they're sleeping better and having more control emotionally. And they're feeling more upbeat. Again, this starts to give us indication of a very important monitor that people start to see that when I do a little more of this, it also helps me in these other areas. Now, as we go on and we look at these functioning areas, you start to see on the screen that this has been normed. And it's been normed based on 100 points. And so what we're finding is that if you are over 50 points, more like 60 points, then you're in the good to high or moving into the best health. If you're 50 to 40, you're in the mid-range. You're not the best health, you're not the poorest health. And below 40 is that you're in the lower range. So what we're going to be doing is setting up these three ranges, and will help us start to look at how much impact is the Well-Being is Natural program having on the people that are starting out with their baselines in the lower quadrants, below 40, and what kind of impact is it having on people that are starting at the higher range, over 60. Is there a difference? In our initial clinical trials, we found that people that were in the lower range improved greater because they had a larger distance to improve. However, the people in the higher range seemed to reach a higher goal or increase in their physical functioning faster, and they tended to maintain it longer because they already had support mechanisms in their environment and in their lifestyle that help promote what the Well-Being is Natural program is helping us promote. Now, this SF36 will be available to each member that's going to come into the program. There will be a protocol for them to follow that will give them instructions on how to go through the survey. That's 36 questions. It's probably going to take them somewhere about 15 or 20 minutes at the most. It'll be where they just go on to their tablet and they can take that inventory. And there will be very clear instructions about why we're giving it to them and the importance that it is to them, that they themselves understand their own level of physical functioning, that this isn't a test to see if they're a good person or a bad or how poor their health is. It's one that can change, that it's not a grade they're going to get that's going to stick with them. And it may change even daily, but they start to see that they start to have more and more control over these 8 areas, and that they can, within just the way they live their life, improve those 8 areas. as a result of this, it's going to help us with the Well-Being is Natural and the Catalytic Health Partners understand more and more, are we doing the things that are meeting our goals? Are we helping our members be healthier people and be more happy and have a greater sense of well-being in their life?